Can you talk a little bit more about the growing variety of treatment options and the progress that the migraine community has made recently and the impact on the management of this disease?
Yeah, definitely. And I have to say that over the past several years, the migraine community has really made a significant progress on the new treatment options for migraines. It's a very exciting time in the migraine world with all the new treatment options that became available. So there have been 4 migraine-specific medications that received FDA approval since October of 2019. So lasmiditan was approved in October of 2019. Ubrogepant was approved in December of 2019. And rimegepant was approved in February of this year. So those 3 medications are FDA approved for the acute treatment of migraine. And then eptinezumab, which is a CGRP monoclonal antibody to be given intravenously every 3 months, for the prevention of migraine, was approved in February of 2020. So there are definitely a lot of new treatment options available for migraine patients. And among them, the eptinezumab, ubrogepant, and rimegepant are CGRP-targeted therapy. So CGRP is calcitonin gene related peptide. It's a neuropeptide that plays a key role in migraine pathophysiology as it causes neuroinflammation, vasodilation, and pain transmission. And the concentration of CGRP in the blood is elevated in patients with migraine and also elevated during migraine attack. So it's definitely a very important kind of target for the migraine world. So 2 types of CGRP blocking modalities, including the monoclonal CGRP antibodies and the small molecule CGRP receptor antagonists, have been developed to target the CGRP, either the ligand or the receptor. The CGRP monoclonal antibody includes, currently there are 4 CGRP monoclonal antibody, one like iranimab, fremanezumab, galcanezumab, and eptinezumab. And currently there are 2 gepants that are FDA approved for the acute treatment of migraine, which is ubrogepant and rimegepant. Lasmiditan is not like a CGRP antagonist, but lasmiditan has a different mechanism of action. It is a highly selective serotonin 1F receptor agonist that acts on the trigeminal system. It is quite similar to the mechanism of action of the triptans. However, the receptor lasmiditan targets is different. So lasmiditan targets the serotonin 1F receptor versus triptan targets the serotonin 1B, 1D receptor. And lasmiditan, importantly, does not cause vasoconstriction. So we can use lasmiditan in patients when the triptans are contraindicated, or patients that did not find triptans helpful. So which allows us to use lasmiditan in a lot of patients. For example, patients that had coronary artery disease, a history of heart attack, or history of ischemic stroke, or like patients with hemiplegic migraine. In those situations, triptans can be contraindicated. And so like those new medications really give us a lot of options to like a large population of patients with migraine. So this is definitely very exciting.